My name is Margaret, and I'm here to talk to you about robotic surgical devices, specifically the Da Vinci system, which was named after Leonardo da Vinci, specifically because of his ability to combine art, anatomy, and science into his work of invention and innovation. Right now, you might be wondering, what is that? And it is a robotic surgical device that is used in remote control surgeries. It is an endoscopic surgical device that was developed in the US, and it is one of the first robots to be approved by the Food and Drug Administration. This device is used for minimally invasive procedures, and in the initial prototype there was a problem with viewing, so for this the stereo viewer was developed, which is a camera at one end of the endoscope. Therefore, the device is made up of two main components: the master tone manipulator, which is where the doctor can control the robot, and the patient tone manipulator, which is where the instruments lie. The device has been developed over the last 2 decades and has provided a completely new way to carry out surgery, and it can be applied for cardiothoracic surgery, urology, and neurosurgery. There's one example in particular of an old woman who had a surgery that needed to be removed. And without the Da Vinci Surgical System, she would not have been able to have this surgery. So the way that this equipment can be used is that the doctor does not have to stand directly over the patient, but they can be off to the side of the room and use a stereo viewer to complete the surgery by controlling the robot. This is very beneficial also to the surgeon, as they do not have to stand for surgeries that can last up to 12 hours long. There are many challenges that come with this device, such as the cost of surgical procedures, the equipment and maintenance, but there's a much larger imposing challenge that comes with machine learning, as AI will come to learn surgical techniques and it will be able to assess the actions of the user of this device. But it can also be used to aid for real-time decision-making during a procedure. This medical device directly correlates with the UCL Grand Challenge of Mental Health and Wellbeing, because surgeries which were previously too complicated can now be easily carried out, and therefore directly contributes to the physical well-being of patients. Thank you for listening, and I hope you now know a lot more about robotic surgical systems and the Da Vinci surgical system.